Hey everyone, Brian Hutchison, Global Career Guy here, back for episode 57. It's a 3Qs episode, so I am sitting here with
Anwaar Najmi.
Anwaar Najmi. And Anwar, you and I actually just started working together, but you do something very different than what I do. So could you share with the audience what it is that you do?
I work as a project assistant for our HRSA grant here at the Counselor Education Department at NJCU. I do all things administrative, research, and I'm kind of like a go-to person for our grant as a representative for it.
Yeah. And so HRSA, I bet a lot of people out there don't know what that is. Tell us a little bit about the grant.
So HRSA is funded through our federal government through the Health Resource Service Administration. Basically, what we do here is all the students that are recipients of our grant here, they receive a $10,000 scholarship that helps them finance their education or whatever they may need. And basically, we offer specific trainings and a lot of specialized attention, and a lot of it, and it's surrounded around integrated healthcare. So that's really where our initiatives are in having these students to start thinking in that framework of integrated healthcare and basically preparing them for the workforce.
Yeah. And so your background is in social work. You have a master's in social work, right?
Yes, I do.
And so when I think about social work, you're like the systems changers, the systems interventionists. And so as a social worker, when you look at this idea of integrated healthcare, can you talk a little bit about like what you think the impact of that might be on a community?
Absolutely.
And just to remind, like we work in a very diverse community of race, ethnicity, country of origin, poverty, so on and so forth. Sorry to interrupt.
No, it's okay. I definitely, as a social worker, think that this program is great because of the way that we are putting ourselves in, like you said, in a very diverse community, and we're learning how to work with people at different levels and different capacities, but also working in an integrated model with, our counterparts in our settings, such as physicians, nurses, physician assistants, so on and so forth. I think that like collaboration is really important and honestly affects the level of care. And just like I said, as a social worker and how that affects people just from top to bottom, it kind of makes their experience more holistic, and also, looking at that person from from the physical perspective, but also the mental and emotional as well.
Yeah, great. And so changing the topic to you, this is your first full-time position out of your master's program. Where do you see this kind of work taking you into your future?
I definitely wanted this to be the start of a long career in higher education. I like working with the student population, and I hope that eventually I can service students at the larger level, so sitting in a role as like a dean. So I'm working towards that right now, and this is a great place to start.
Yeah, that would explain why you're kind of taking charge of the entire place, it feels like. In a good way.
In a good way. Yeah.
In a good way. No, talk about impact. You've only been here a few months, but you're already seen widely as a face of the HRSA. Your interaction with students and different departments on campus, it's been pretty amazing. Yeah. So last question, when you think about your life and the choices that you've made for a career, how does what you do impact the quality of your life?
Wow.
I know. I
loaded
surprised them with the big question at the end.
I'm actually I'm really happy with what I'm doing because I feel, in terms of my career, I feel very satiated. I'm helping people. I'm, able to do a lot of, it's a very dynamic position. And I'm someone, I find myself, I get bored really quickly. And I feel like when I'm working in this environment, there's no way that you possibly can get bored with things always constantly changing. So, I'm really satisfied, if that answers your question. I'm happy with what I'm doing, and I'm happy with the people that I'm supported by.
Excellent. Very good. All right, let's get together on the screen. Thank you so much. This was episode 57, Global Career Guy. Keep tuning in, and let's keep the conversation going.
Bye.